Hello everyone. This video will be useful for you to learn something about essential competencies of midwifery. So, midwifery is both art and science that focuses on care of the woman, newborns, and family during pregnancy, childbirth, and postnatal period. So, a competent midwife, she will play a crucial role in ensuring safe motherhood, and also she will make sure the maternal and neonatal mortality and promoting positive birth experiences. So midwife is a person who give positive birth experiences for any woman during her pregnancy, childbirth and postnatal period. So to deliver this quality care, every midwife must possess certain competencies, that is essential competencies. So these competencies are nothing but it is a combination of knowledge, skills and attitudes and professional behaviors. So these competencies guide the midwife in providing safe care, ethical, evidence-based and woman-centered care, right? Myself, Ruth Kezia, lecturer working in Triple M College of Nursing. Objectives. In this video, we are going to see introduction, key concepts, scope of midwifery practice, International Confederation of Midwives, ICM framework of overview, category 1, 2, 3, 4 of midwifery competencies. Introduction. The term competencies is used to refer both the broad statement heading each section as well as the knowledge, skills and behavior required of the midwife for safe practice in any setting. The competencies are evidence-based. The essential competencies for basic midwifery practice is complemented by ICM standards and guidelines related to midwifery education, regulation and clinical practice. So, to understand about this midwifery competencies, I'll just give you an analogy. Think of midwifery competencies as a building of house. The foundation is the general competencies such as ethics, communication, and professionalism. The pillars are the clinical skills like antenatal, intranatal, and postnatal care. And the roof represents specialized competencies like managing complications and emergency situations. So, without a foundation, the house cannot stand. Similarly, without general and specific competencies and skills, you cannot safely practice and effectively practice midwifery profession, right? Key concepts. There are a number of key midwifery concepts that define the unique role of a midwife in promoting the health of women and childbearing families. These include partnership with the woman to promote self-care and the health of a mother, infants and families, respect for human dignity and for women as person with the full human rights, advocacy for women so that their voices are heard, cultural sensitivity including working with women and healthcare providers to overcome those cultural practices that harm women and babies and focus on health promotion and disease prevention that views pregnancy as a normal life event. So these are the key concepts you have to understand, that is partnership, giving respect, advocacy, cultural sensitivity and health promotion. Scope of midwifery practice. The scope of midwifery practice is built by ICM and it recognizes the midwife as a responsible and accountable professional who works in partnership with women to give necessary support, care and advice. And this care will include preventive measures, promotion of normal birth, detection of complication in mother and child, accessing of medical care and other appropriate assistance, and carrying out of emergency measures. The midwife has an important task in health counseling and education, not only for the woman but also within the family and community. This work should involve antenatal education, preparation of parenthood, and may extend to women's health, sexual or reproductive health, and childcare. So these are the scope of midwifery practice. So where the midwife can practice means, so giving the preventive measures, promotion of health, okay, giving health counseling and education, detection of complications, and accessing the medical care and other appropriate assistance and carrying out of emergency measures. These are the scope of practice for a midwife. ICM, that is International Confederation of Midwives. The Council adopted the International Confederation of Midwives ICM competencies for training nurse practitioners in midwifery for India. These competencies are organized under four comprehensive categories that define professional midwifery practice standards. So this is the ICM framework overview where there is four categories of competencies that must be possessed by any midwife. So first is general competencies where there is professional accountability and autonomous practice, then pre-pregnancy and antenatal care, labor and childbirth, which involves safe delivery and immediate newborn care, and ongoing care, which involves postnatal support and family planning services. These are the four categories of ICM framework. We'll see the category one by one. Category one, that is general competencies. First is professional accountability and autonomous practice. So the NPMs, that is nurse practitioners in midwifery, must demonstrate professional accountability as autonomous practitioners in delivering midwifery care consistent, so within the standards of ICM, within the standards of moral principles and humanistic values in midwifery practice. So practice according to the standards and legal guidelines, and so the midwife has to um, maintain the confidentiality and privacy. Okay, the midwife has to respect the woman's rights and dignity, and the midwife has to respect the woman's autonomy, and the midwife has to practice within the scope, and she is also responsible and accountable for her every actions and decisions. Okay, so in professional responsibility, she will assumed responsibility for own decisions and action as a autonomous practitioner, take a responsibility for self-care, including personal safety and development. So it means continuing nursing education, okay, and appropriately delegate aspects of care and provide supervision. Next is evidence-based care, utilize research to inform practice decision, adhere to laws, ethical and regulatory requirements, follow codes of conduct for midwifery practice. Next is core professional values. Under that, we have the human rights, effective communication, and safety protection. Upholding human rights. Uphold the fundamental human rights of individuals when providing midwifery care and facilitate women to make individual choices about their care. So that is giving autonomy. Okay, basically respecting the autonomy of the mother. And effective communication. Demonstrate effective interpersonal communication with women and families, healthcare teams, and community groups. So one to one as well as one to many communication should be effective. Okay, whatever you say must reach, and you should make sure they understand whatever you have communicated. And safety and protection. Care for women who experience physical and sexual violence and abuse with sensitivity and appropriate support. Next is comprehensive care delivery. Under that, we have comprehensive care delivery, prevention and treatment, health assessment, and appropriate referral. Facilitate normal birth processes in institutional and community settings, including women's homes, ensuring safe and supportive environment, prevent and treatment, prevent and treat common health problems related to reproduction and early life with evidence-based intervention. So evidence-based means you have to use the current scientific knowledge and apply the clinical guidelines and protocols. Okay, and also you should continuously keep learning about to get updated with this evidence-based practice, and also do the health assessment, prevent and treat common health problems related to reproduction and early life with evidence-based intervention, appropriate referral, prevent and treat common health problems related to reproduction and early life with evidence-based intervention. Category 2. So this is the category. Till now we saw the category 1 and category 2, that is pre-pregnancy and antenatal care, health assessment and pregnancy monitoring. So, nurse practitioners midwifery must perform comprehensive health assessment of women and fetuses to promote the health and well-being, and she should detect complication during delivery, during pregnancy, and provide care to women with unexpected pregnancy also. And pre-pregnancy and antenatal care. In pre-pregnancy and antenatal care, she should provide comprehensive care and determine the status of the woman. Okay, so in antenatal care, the specific competencies for the midwife or as identifying the risk factors and danger signs and monitoring blood pressure, weight, and fetal growth, providing antenatal counseling, and ensure early detection and referral for the complications. And pre-pregnancy and antenatal care, she has to perform fetal assessment, assess the fetal well-being, and monitor the progression of pregnancy. Health promotion, that is promote healthy behavior and improve well-being, provide anticipatory guidance, and that is giving health counseling related to pregnancy, birth, and breastfeeding and parenthood. Category 3, under that we have the care during labor and childbirth, facilitating physiological birth processes. Nurse practitioners in midwifery continue to monitor and provide care to women during labor that facilitates physiological processes and safe birth, provides immediate care to newborns and infants, and detects a complication in mother and infant. So here basically what the midwives does means she has to assess the progress of labor with she has to she should know how to use a partograph, okay, how to write the partograph, and she has to maintain asepsis and infection prevention throughout the labor, and she should provide supportive care during labor, and she should conduct a safe and clean delivery, and she should anticipate any postpartum hemorrhage and prevents it accordingly. Okay, and also she has to perform newborn resuscitation whenever required. So these are the specific uh, midwifery skills expected, midwifery competencies in intranatal care. Okay, so that is grouped under these headings, namely promote physiological labor, manage safe birth and immediate newborn care, support normal, that is natural labor process and create optimal conditions for physiological birth, managing safe birth, that is manage safe spontaneous vaginal birth and prevent complication during delivery. In immediate newborn care, provide essential care of the newborn immediately after birth. Care 4, that is category 4, ongoing care of women and newborns, postnatal health and family planning. The nurse practitioners and midwifery continue to perform this health assessment even after birth also for the mother and the infant, and also she will provide health education and support breastfeeding, and she should detect any complications and initiate family planning services. Okay, so in postnatal care, the midwifery has to watch for bleeding, infection. She has to monitor the vital signs the next 1 hour immediately after delivery of the placenta, also for the next 24 hours, or also for the first 1 week and 1 month. Okay, so monitoring the vital signs, and assess the newborn's temperature and assessing the feeding of the newborn, okay, assessing the breathing of the newborn, okay, support early initiation of breastfeeding for the mother, and also educate the mother regarding postnatal self-care. Okay, so the personal hygiene is very, very important in the postnatal education. So this is about the some of the midwifery competencies required in the postnatal period. Also, regarding this newborn competencies, the midwifery will immediately do the essential newborn care. She should be um, skilled enough to provide immediate essential newborn care. She has to maintain warmth and hygiene, identify any danger signs in newborn, administering vitamin K and immunization, and educating the parents on home-based newborn care. Okay, all this has to be educated by the midwife to the mother and the child. And also regarding this managing complications and emergencies, she has to recognize obstetric complications such as postpartum hemorrhage. This all comes under the postnatal competencies. Okay, post identifying any postpartum hemorrhage, eclampsia, and obstructed labor, and she should initiate first line management, and she should do the timely referral, and she should work effectively as a part of emergency care team during the postnatal period. And conclusion, essential competencies of midwifery form a continuum from general to specific skills. So general skill competencies provide the ethical, professional, and communication foundation, while specific competencies enable the midwife to deliver safe and skilled maternity care. A competent midwife not only assists childbirth but also protects life, promotes health, supports women and families throughout the maternity journey. So a midwife is not just trained to deliver babies, but educated to care, protect, and empower women and newborn. Okay. So to conclude, so if you want, if you to say about this key outcomes, what is essential competencies of midwifery: autonomous, accountable, and professional practice, comprehensive pregnancy and birth care, safe delivery and newborn management, ongoing maternal and infant health support, and family centered care and education. So I hope you gained some knowledge regarding these competencies of midwifery. Thank you all.